I'm Sanj Bassi. I'm a consultant adult and paediatric neurosurgeon dealing with brain and spine problems across the whole of the age ranges.
What paediatric conditions do you specialise in?
As a paediatric neurosurgeon, we deal with conditions that affect really from premature babies, which would include brain hemorrhage, dealing with the aftermath of meningitis, which can cause hydrocephalus. That's a big part of our work. And as part of the sort of the hydrocephalus scenario, you have children with spina bifida, Chiari malformation, syringomyelia, and obviously lots of shunts. The rest of the third of the work is probably made up with brain tumours, and then we deal with just head injury, spinal trauma, as well as dealing with dysraphic spines, which includes things like the spina bifidas and the myelomeningocele.
What would happen in a paediatric consultation?
With a paediatric consultation, it very much depends on the age of the child. So for the babies, often it will be mum or dad who will give the story about what their problems, what their concerns are. And that'll probably take 10-15 minutes just running through things pretty from the antenatal period, any problems during the pregnancy, to what their concerns were with the baby at whatever stage, what investigations they've already had with their paediatricians. I would then generally examine the baby, whether that's the head or the spine, and then we'd sit and talk through what my thoughts are and formulate a plan. That may be to organise some scans, it may simply be reassurance, it may be something more. For an older child, I think it's paramount to engage children in early. I looked at consent and understanding in children about their own illnesses, and I published something that many years ago. By the time children get to 4 or 5, they get a good idea of self. So you try to engage the children. They don't just know the nitty-gritty of risks, but you can explain to a 9 or a 10-year-old what risk may mean with surgery. For example, you go on holiday, you get on an aeroplane. Every child knows that aeroplanes will get from A to B, usually without a problem. But once in a while, then an aeroplane can crash. It's the same thing. You can explain that to a 6, 7 or 8-year-old. So it's in terms of what one says to a child during consultation is based on, 1, their age, but 2, an appropriate respect and understanding that actually children take a lot more than we sometimes give them credit for.
And what are some of the treatments that you offer your paediatric patients?
The things that we do for our paediatric patients include treatment of hydrocephalus, which is when there's excessive fluid build-up in the brain, and we may divert that fluid internally, something called a third ventriculostomy. We may divert that fluid with a small tube under the skin called a shunt, and that probably makes up about 1/3 of my operating. For children with brain tumours, again from under my care, they may need brain surgery. Once that's occurred, they'll then go on to see the oncology teams, whether that's radiotherapy or chemotherapy, depending on the type of tumour. For our children with spinal problems, again, they may need surgery to either fix the spine, stabilise the spine, or close off some of the nerves.